Hello and welcome. Today we'll be discussing what is an induction of labor. Induction of labor is the process by which we OBGYNs provoke labor if you're not in your own natural labor. So induction can be an elective process in which the patient chooses to be induced. This may be for various reasons, some of them being maybe general discomfort of pregnancy. You may have had a quick delivery the first time, or maybe you live far from the hospital. So this is normally offered at 39 weeks, a week before your due date. Okay? It can also be medically indicated, in which your provider, if you have some sort of medical condition, recommends that you deliver earlier than your due date. This could be at 39 weeks or even earlier, depending on what the problem may be. So some of those issues may be your pregnancy has lasted longer than 41 to 42 weeks. You may have some sort of health problem with your heart, lungs, or kidneys. Placental issues. Your fetus may not be growing appropriately. Maybe it's growing a little bit smaller than it should. You may have low amniotic fluid, a uterine infection, gestational diabetes or diabetes prior to the pregnancy as well. Chronic hypertension, preeclampsia, or eclampsia would be other reasons. And last but not least, premature rupture of membranes, meaning your water has broken before you go into your own natural labor. Now I'd like to discuss the methods that we use to induce labor. So the process of inducing labor requires us to ripen the cervix. What does this mean? This means thinning out the cervix, causing dilation of the cervix in order to allow the head to descend into the pelvis. One of these methods is Cytotec. This is a pill that can be administered in the mouth or also vaginally. This pill helps to dilate the cervix, soften the cervix, and essentially what we call ripen the cervix. We can give up to 6 doses of this medication. It's typically given 4 to 6 hours apart from each other. We don't always have to give all the doses, but we can give up to 6. Next medication would be Cervidil. This looks kind of like a shoelace, and it is administered vaginally right by the cervix, and it has a very similar effect to Cytotec. Its job is to essentially thin out the cervix, ripen the cervix, and allow for dilation, and will cause contractions. Next are some mechanical dilators. So we can insert a balloon, either Foley or Cook's. You might hear either one being used. It's filled with water, and its job is to essentially cause pressure on the cervix to allow it to dilate, and often it is used together with either Cytotec or Pitocin. I will now move on to Pitocin, which is probably what most of you are familiar with. So this medication is administered via the IV. It is used to cause contractions that are closer together and stronger. This is typically used after we ripen the cervix, or to say once your cervix has thinned out appropriately and the head has descended, now is the time that we would use Pitocin. Another type of induction method is to break your water. So this we only do when the head is applied now in the pelvis, and this can help your labor progress further. I'd like to now discuss pain control. So labor, whether it's induced or natural, it can be pretty painful. So there's 2 main options. One would be IV medication, and the other would be an epidural. Let's start with the IV medication. So IV medication given is either morphine or fentanyl. These are narcotics, but they are very safe to use during the process of labor. The typical length of these medications are 2 to 4 hours, and it can only be redosed after a 4-hour period. Next, I'll discuss the epidural. So this is done by the anesthesiologist. It is when a small catheter is put in your spine, and through this catheter you get continuous medication for relief of the contractions. It does numb you from the waist down, so you won't be able to really walk around or get up after this is placed, but it has very good pain control. As in any procedure, there's always risks, so I'd like to talk about some of those risks in the process of induction of labor. So one of those risks is that the medications that we use do cause contractions. They tend to be stronger and cause contractions that are closer together, which can overstimulate the uterus. What does this all mean? Essentially, this can cause stress to the baby. We're constantly monitoring, and it can cause the baby's heart rate to dip. So this could be one of the complications. Another is that during the process of induction, you can possibly develop an infection. It can be an infection to the uterus, an infection that develops in the amniotic fluid, or even infection to the baby. Another risk would be maybe the induction does not work and you're not able to have a vaginal delivery for various reasons. One of the major reasons being that maybe the baby is just not tolerating labor very well, and then a C-section might be indicated at this time. Now let's discuss how to prepare for your induction. First of all, please, please, please eat. So you definitely want to make sure you eat before arriving to the hospital. Although in some instances we might let you have a meal and you may be able to eat through your induction process, there are instances where you might not be able to. You may only be regulated to just having clear liquids, and sometimes we may not allow you to eat at all just for your safety and baby's safety. Another thing is you might want to bring things for your own comfort, maybe a pillow, some music, anything that's going to give you comfort in the hospital, as this can be a long process that lasts 3 to 4 days. We look forward to taking care of you. If you have any further questions, please feel free to ask your OB provider. Thank you for your time.